Tonight, a push to improve mental health care in Arkansas. This time, the focus is children. UAMS and Children's Hospital are teaming up and launching a program that leaders say will address a dire situation. THV 11's Frederick Price shows us how.
More than 2 years into the pandemic, Dr. Chris Smith with Children's Hospital at UAMS says mental health help in Arkansas is still not easy to find.
There's a real disparity throughout the state in rural areas as well, as more of the urban areas.
But it's an issue that doesn't just impact adults. He's noticing children who might be visiting the doctor for something as simple as a sore throat may have deeper issues.
When you start asking questions, it's like they're really dealing with underlying depression.
ER visits from children seeking mental health assistance have doubled, Dr. Smith tells me, and the pandemic, he says, contributed to that increase.
Now a big push among leaders at both hospitals to improve the availability of mental health services. Over the next 4 years, $2 million in total will go toward creating more resources inside clinics across the state. It's all a part of their Children's of Arkansas Mental Health and Primary Care, or CHAMP, program.
Will allow us to provide education for primary care physicians.
Dr. Smith tells me this program really focuses on the aid primary care doctors could give.
25% of the kids that come in we might need to address mental health care.
This team of doctors will actually see and treat mental and behavioral patients. He says this project will start here in Central Arkansas and eventually expand to all clinics in the state. And he's hoping this will have a lasting impact.
It's just a way for us to reach out across the state to be able to ultimately touch the lives of every child in every community or small town.
In Little Rock, Frederick Price, THV 11 News.
Dr. Smith says after 4 years, he'd like to see both hospitals create a pipeline for more mental health providers. This could address the disparity he says the state is seeing.